Gastrointestinal endoscopy is considered an aerosol generating procedure. In the present COVID pandemic, there is increased risk of viral transmission from patient to endoscopist, anesthetist, and other healthcare personnel. Use of patient triage, viral testing, personal protective equipment, and negative pressure room can decrease this risk. Pre-procedure viral testing, PPE, and negative pressure rooms are not always available. Aerosol chambers have recently been used to reduce aerosol spread and transmission of virus during endotracheal intubation. We have started using aerosol chamber designed indigenously by Mahindra & Mahindra. This is done with a dual purpose of safe endoscopy and endotracheal intubation. The aerosol chamber consists of 4 flat polycarbonate sheets which are assembled into a box with 4 closed sides. These sheets are 4 mm in thickness. 2 holes on the head end are oval, measuring 157 into 125 mm, while holes on the side wall are circular, measuring 125 mm in diameter. The flat sheets can be assembled into a box using an interlocking system. Time taken for this assembly is less than a minute. Thin plastic disposable sheets are used to cover the holes, and these are easily pierceable. After positioning the aerosol chamber around the head of the patient, the anesthetist pierces the sheath over the 2 holes on head side with his hands. Endotracheal intubation is then done within the chamber using a laryngoscope. Patient is then put in the left lateral position and side hole of the chamber is pierced with an endoscope. Endoscopy is then performed by standard technique. This patient had severe gastritis and a biopsy was done. After completion of procedure, chamber can easily be dismantled and disinfected before reuse. Endotracheal intubation, however, may be difficult within the aerosol chamber in patients with short neck. Moreover, a validation study is needed to quantify the benefit in terms of reduced spread of aerosol and decreased risk to endoscopy healthcare personnel. Potential advantages of our aerosol chamber include quick assembly and dismantling, rapid sterilization of chamber after dismantling, reusability, dual protection during both endotracheal intubation and endoscope insertion, and low cost.